afternoon, beautiful New Zealanders. My name's Michelle from Pro Beauty, and I am so delighted to be able to introduce you to Dr. Andrew Christie Swartz, who is going to take us through all things new and exciting in Dermapen this afternoon. Andrew got up really early this morning to deliver all this information to us. 4:30, if you please. So thank you so much, Andrew, for all the effort.
It's a pleasure to be here.
So for everybody listening, if you have questions that come to you through Andrew's presentation, please just pop them into the question and answer box. And at the end of the session, Andrew will run through questions and answers with us. So handing over to Andrew.
Thank you so much, Michelle, and thank you so much to Nikki, who is in the background, and also to Pete from Australia, who is producing behind the scenes as well. So with your questions and answers, I'm going to try and stick to around about 45-50 minutes for the presentation today. So anything that relates into today's presentation, we can answer live. Anything which links into another topic, another area, then one of the team from Pro Beauty will get back to you directly. Just make sure that you add your details so that we can contact you. And then likewise, anything which is completely separate to what we cover today may be an area which we will cover in another webinar as well. So a huge welcome. What I really want to focus on is a 4-dimensional approach to your patient's skin, which means a combination of Dermapen, a combination of the new MG collection, which I will be introducing and launching for you officially today, then adding in our Uber chemical peel, but then also backing all of that up with home care as well. And so what we are now creating and delivering is the ultimate synergy of solutions, a 4-dimensional effect, but now being able to create the ultimate treatment programs for our patients as well. So at this point, I am going to share my screen for a presentation. What I suggest is if you do have your smartphone handy, is you can just simply take a photograph of the screen, particularly when I get onto key ingredients, and particularly also for some of the individual products which are coming through as well. Perfect. So we now have screen share. So welcome to the DP Dermaceuticals MG collection and the Uber revolution. And so to begin with, I really just wanted to recap on why you're working in with microneedling and why you're working in with Dermapen in the first place. We understand the value of any treatment that you offer, any and every treatment within your menu. The value of it is only its link in with the modern patient. We understand that the modern patient has very high expectations. We also understand that the modern patient does not want a procedure which is highly uncomfortable. They don't want a procedure which has extensive downtime, and neither do they want a procedure which is going to require a lot of money for this. And so the concept of having a procedure such as Dermapen now delivers in on all of this. It's comfortable, it's quick, it's fast, it's effective, but most importantly, it's affordable. We also understand that the largest growth area within aesthetics and within aesthetic medicine is what we refer to as regenerative medicine. And so one of the ultimate pioneers of regenerative medicine is microneedling. By instigating your own process of wound healing and regeneration, you now guide your own process of healing, repair, and rejuvenation for the skin. But of course, we're going to have a look at other regenerative procedures, which will take into account particularly mesotherapy with the MG collection as well. What lies as an important aspect for your Dermapen procedures is that it is predictable and safe. There is no heat within this device. Likewise, there is no ablation with this device. We have a clean entry point and a clean exit point. So by comparison to rollers, it's not cutting and arcing through the skin. By comparison to laser or IPL, there's no thermolysis or heat. So what we deliver is a very, very predictable and a very, very safe treatment that is suitable for 100% of Fitzpatrick skin types coming into your business, but also 100% of ethnicities coming into the business as well. Where we get our versatility is understanding that microneedling is more than just collagen induction therapy. It's more than just scar revision. It's more than just anti-aging. But understanding the versatility for hyperpigmentation, including melasma, understanding its versatility for rosacea, for acne, hair restoration, we now see the versatility of this device. But now by adding in our combination therapies with the MG collection, but also with Uber Pro and also with Uber MD, what we now do is open up the opportunity for faster, more dramatic, and more versatile results that now appease the modern patient. That's affordable, that's quick, that's fast, that's comfortable, but without the extensive downtime as well. Although the concept of mesotherapy is a mainstay of aesthetics here in France, mesotherapy is relatively new to the Pacific and to the New Zealand market. When we look at mesotherapy itself, it didn't have its origins until the late 1940s. The term mesotherapy didn't come about until 1958, and its development is Dr. Michel Pistor here from France. It's now reviewed as being a speciality of medicine here in France at the Académie Nationale des Médecins. But likewise also, this is one of the pioneers of regenerative medicine. The concept is that by using tiny micro injections, we are now able to introduce a biomimetic substance. So a substance or ingredient that the skin knows, makes, uses, and recognizes. We can now bypass the skin's acid mantle and then deliver it physically into the skin. So the concept of mesotherapy, particularly for aesthetics, is about feeding the skin with the right ingredients, feeding the skin with ingredients that it recognizes, so that we are now creating the ultimate relationship that now promotes effective rejuvenation, effective regeneration as well. So for the aesthetic market, depending on what is being put into the skin, now also gives us versatility, whether that's pigmentation, whether that's anti-aging, whether that's scar tissue, whether that's rosacea, moving into alopecia, even for acne, but it also takes us into other areas of the medical market for pain relief, for tendinitis, for gum disease, for arthritis as well. With traditional mesotherapy, what we have is a mesotherapy needle here. So in this case, this is a 4mm needle. In order to get that biomimetic, in order to get that active into the skin, it gets injected into the skin. So tiny, tiny injections of vitamins and biomimetic agents into the skin. So when we look at the pros and cons of this, the advantage is that we're getting an active substance into the skin, but the disadvantage, particularly when we look at needles, is always going to be the risk of bruising, particularly around the periorbital area. When we look at administration for a full face or for a full neck, we may be looking at 400, 600 plus injections. When we look at the actual concept of an injection with a needle, this always means that we've got the fear of patients, particularly if they're scared of needles. But then, of course, when you're undergoing that many injections, there's always going to be a lot of erythema and also a lot of edema. So there's going to be some downtime in order for that swelling to reduce. So how do we get the best of both worlds with microneedling, but the best of mesotherapy to combine them together to create the ultimate synergy of solution? Before I answer that question though, I now want to have a look at why we now want to add into our story and add into our program, our Uber Pro and our Uber MD. The philosophy of Uber is to have a safe application of a chemical peel agent immediately following your Dermapen procedure. So this is not designed for application before your Dermapen, it's following your Dermapen procedure to maximize a fractional delivery as the fractional channels begin to close. The innovations with the Uber Pro here is what's called a peel emulsion technology. We commonly see with peels that they are either water-soluble agents, glycolic acid, lactic acid, so the alpha hydroxy acid family, or we see that they are oil-soluble agents if we think of salicylic acid. The concept of peel emulsion means that we can blend but still remain active for both aspects of water-soluble, oil-soluble, but then also agents which traditionally work at a higher pH, which includes retinoids. And what combines this is the peel emulsion technology, which is a combination of dimethyl isosorbide, but also resorcinol. And this serves as the emulsifying agent. As such, with the Uber Pro, we class this as an anabolic mesotherapy peel. So as opposed to your traditional chemical peels, which is taking something away, when you create your 1,920 puncture channels per second in with your Dermapen 4 here, as those puncture channels begin to close, application of the Uber Pro now allows the opportunity for it to drizzle down those puncture channels, and it works more similarly like a mesotherapy to promote a process of rebuilding and regeneration. The ingredients include mandelic acid, hyaluronic acid, pyruvic, lactic, ferulic, copper peptides, retinaldehyde. So we see this perfect blend and synergy through the peel emulsion, which now opens up opportunity to make it more similarly to mesotherapy than to a traditional chemical peel. So this means that the Uber Pro is suitable for all Fitzpatrick skin types coming into the practice and all ethnicities coming into the practice. So you have suitability for everyone. Likewise, because you were creating your fractional puncture channels with your Dermapen beforehand, it means that the peel is drizzling down those fractional puncture channels, which means that this is a fractional chemical peel. It has self-neutralizing properties, but you also have a very, very predictable outcome, which means that you should never see any frosting. You should never see any blanching. There should be no bruising, no flaking or downtime following its application. Versatility means that you can apply it following a Dermapen procedure to create the ultimate synergy of solutions, but it can also be used as a standalone chemical peel for a minor resurfacing in between your Dermapen procedures. The indications for your Uber Pro are most specific for hyperpigmentation, particularly melasma, for acne, stage 1, 2, and 3. You can use it as a standalone procedure for acne stage 4, but I just wouldn't recommend Dermapen for acne fulminans or acne conglobata. But it can also be used as a generalized refresh, particularly for an aged or sun-damaged skin. So we see versatility by combining in our microneedling, combining in our mesotherapy and infusion, but now combining in the Uber Pro. The Uber MD has a few more rules and restrictions for this. It's been inspired by the original TCA cross technique, which stands for chemical reconstruction of scars and striae. And the traditional way of working with this was a very, very high percent of TCA, and using a toothpick, it's applied into areas of atrophy. This then creates a coagulative necrosis, which then in turn creates a controlled chemical wound, which then forces the regeneration of atrophic scar tissue, particularly for post-acne rolling, boxcar, and ice pick scars. The challenge is with the traditional TCA cross is not always so predictable, which means that some patients will require a couple of coats, which means that not all patients frost. If it doesn't frost, then you don't create coagulative necrosis, and then you're not going to achieve your end point. So what we have with the Uber MD is an updated and reliable solution for the traditional TCA cross, which allows for an appropriate combination therapy, which can be applied immediately following a Dermapen procedure. The innovation for this, I spoke previously that there's always been challenges in the past, particularly with TCA at a high percent, that not all patients frost predictably. How can we do that? The answer is a new category of peeling agents which sit under the banner of beta lipohydroxy acid. The actual ingredient itself is called capriolol salicylic acid. Combine this into the base formula, which is 35% TCA. There's salicylic acid, retinaldehyde, and a small amount of phenol to serve as an anesthetizing agent now means that upon application, you have instant frosting, generally within about 7 seconds. So this means that you have a far more reliable treatment. Rather than applying it physically with a toothpick, what we have are the Uber sticks. And these are a modified dental stick with a tiny sponge here, which means that it holds the product. So simply dip it into the Uber MD, and then it can be administered into ice pick scars, into rolling, into box cast scars. So the application for this and your indications is for areas of atrophy, never to be used for areas of hypertrophy, and never to be applied over large surface areas. So the Uber MD is only to be applied with an Uber stick, never over a large area. So as such, because its application is following a Dermapen procedure at full speed, that's 120 revolutions per second, an unparalleled 1,920 puncture channels per second, which now means that we create a fractional delivery of the peel. So again, using the Uber stick, it now means that you can localize the application exactly and precisely where you need it. Once it frosts, and this is typically in around about 7 seconds, you can fan the skin to try and accelerate that. You will find that it completely self-neutralizes. So this means that you're not having to use multiple applications. It means that you can see exactly and precisely where you are going. The versatility of this means that it can be used following a Dermapen procedure as a fractional treatment, but can also be used as a stand-alone. However, for safety with this product, it is not to be applied on a Fitzpatrick 4.2 and above. If the patient shows any signs of risk of post-inflammatory hyperpigmentation, this is not the product for you. If the patient is not sun smart, this is not the product for you. If the patient is high risk for reactivity, this is not the product for you. So by contrast, the Uber Pro, which can be used reliably as part of a 3-dimensional, 4-dimensional treatment program for your patients, the Uber MD, we do have some strict rules for this. Firstly, it is only to be used with an Uber stick. Secondly, it is only to be used for areas of atrophy, which includes post-acne rolling, boxcar, ice pick scars, anatodermic scars, or atrophic traumatic scars. But the rules are, it is only to be used on skins where there is no risk of post-inflammatory hyperpigmentation, where there is no risk of activating scar tissue. So under a Fitzpatrick 4.2 in this case. So I've spoken about the terminology of fractional, and I've also spoken about being able to break through the skin's acid mantle to now deliver a bioactive physically into the skin, as opposed to just working on the skin's surface. These images you are probably more than familiar with. So these biopsies show, number one, that if you put a topical solution onto the skin surface, it doesn't break through the skin's acid mantle. We understand, however, that if you inject an active solution into the skin, so our traditional mesotherapy here, it bypasses the skin's acid mantle, and the injection does indeed place that active into the skin. This is biopsy number 2. But when we look at biopsy number 3, we actually notice that the solution is substantially more saturated, and the solution has been delivered more effectively into the skin. How was this achieved? It was Dermapen. So with this, we understand that although the needles are solid, they're not hollow needles like a mesotherapy injection, not like a syringe. Although the needles are solid, but at 120 revolutions per second, delivering nearly 2,000 puncture channels per second into the skin, this now facilitates mechanically and physically the movement and the placement of a procedural active into the skin. So we understand that the advantage of Dermapen now enables the delivery of an active substance into the skin with greater efficacy than what an injection does. Likewise, this means that we can treat a full face in as little as 4 minutes, 5 minutes, 6 minutes without an injection, without the risk of traditional bruising, without the time and without the discomfort of a traditional injection, and without necessarily having to use a topical local anesthetic. So we understand that the blend of mesotherapy plus Dermapen 4 now creates the perfect delivery system for our brand new MG collection. But it also opens up opportunity for the delivery of PRP, the delivery of nanofat, but also for drug infusion, combinations of steroids, of antimitotics for control of keloids, but even for mesotox or microdoses of botulinum toxin. But we also understand as these puncture channels begin to close, this now enables an effective delivery and the drizzling of Uber Pro, but also Uber MD into the skin to now create the ultimate of fractional healing. So the reason why we want to combine mesotherapy, the brand new MG collection, and Dermapen together is we create the ultimate of comfort. It is the ultimate speed of administration. So we're looking at as little as 4 minutes, 5 minutes, 6 minutes, 7 minutes, a very, very fast administration for face, for neck. You can use this anywhere on the face, anywhere on the body, anywhere on the scalp. It now means that you can further customize your microneedling, not just based on depth and speed, but also based on the physical infusion of biomimetic agents physically into the skin. We now offer a superior delivery system also by adding in Uber. So quite simply, I think that Dermapen is working from the bottom up within the skin to aid rejuvenation. Your MG collection is working physically within the skin to aid rejuvenation. And then application of your Uber MD or your Uber Pro is now working from the top down. So we have this three-dimensional effect within the skin. Add in topical home care that's ongoing, we now have a four-dimensional treatment program for our patients. What we understand, particularly for comfort, is that with Dermapen, we've got a superior delivery of active substances, particularly by comparison to nappage or point-by-point technique with traditional mesotherapy. This therefore reduces the downtime. So just 36 to 48 hours of a mild to a moderate sunburn in appearance and sensation. You shouldn't be seeing any bruising. You shouldn't be seeing any scabbing. There should be no track marks. There should be no grazing. If you are very ambitious or a little bit over treating, you may find some petechia around the eye area. If you over apply the Uber MD, there will be some small scabbing on those localized areas, but otherwise we have a fast fractional healing and delivery. It's injection free. This appeases the modern patient who is looking for ways to rejuvenate and regenerate their skin without necessarily having to undergo injections. From a medical perspective, we've got no risk of vascular occlusion, no risk of embolism. So we have a nice, safe procedure. And we also open up opportunity, particularly for delivery of PRP, for nanofat, and also for drug delivery. So a three-dimensional approach of Dermapen microneedling, plus our MG collection, plus Uber now creates a complete action plan and program within the skin. So why do we want to go with the MG collection? First off, we've got individual 5 milliliter sterile glass vials here. With it, there is a customized silicone luer lock tip here. With the nozzle, we just simply remove the lid here. It can either be free poured onto the skin easily throughout treatment and then administered by hand that is gloved, of course, but otherwise it links in perfectly with a luer lock syringe. That means that it can easily be drawn up and then administered onto the skin via the syringe, or alternatively, you can actually mix and match your solutions to now create your own customized blend. The MG collection works not only for your standard Dermapen 4, but also for newer technology, which will be hitting the market with the Dermapen Tat-Off, the Dermapen Infuse, but also the Dermapen Inject as well. You can just simply dispense using the silicone nozzle directly into a sterile basic dressing kit and just use your hand to apply. It can be applied directly onto the skin or administered via the Luer lock syringe. So you've got a very, very easy way for administration. To now take your procedure from standard to now a premium prestige procedure, you can mix any of your base MG collection in with two products. These are called HA35 or HA35 Plus, and these are unprecedented mesotherapy containing 35 milligrams per milliliter of non-cross-linked hyaluronic acid. So simply draw up, and then now we combine our solution and simply mix and match to now customize your complete procedure. So with this, the lids are completely resealable, and then you can give any remaining solution to the patient who can then use that topically following their procedure. The design of the product means that there's no risk of vascular occlusion, but also no risk of granulomas. As with all active DP dermaceuticals, what features is a triple molecular weight of manipulated hyaluronic acid to serve as a safe delivery mechanism. So even with the solutions containing the 35 milligrams per milliliter of hyaluronic acid, it's non-cross-linked. So this removes the risk of granulomas. This removes the risk of lumping within the skin. We also have a delivery system that is called a calphosome sponge. So this dual delivery system of hyaluronic acid and calphosome sponges now promotes perfect and effortless delivery of the actives within the skin. The formulation can be mixed and matched as required. No mistakes can be made with this, so you can enhance and customize based on what the skin is telling you. No risk of granulomas, perfect ease and use for face, for body, and also on the scalp. The MGHA, the hyaluronic acids, can be used to facilitate PRP, but can also be used to facilitate mesotox or microbotox procedure. And we have the ultimate in biorevitalization for the skin. So now the combination of Dermapen, the combination of the MG collection, and the combination of Uber MD or Uber Pro now serves as the ultimate in regeneration, the ultimate in rejuvenation. And with this, all of the MG collection products contain a specialized blend of botanicals to promote faster, more effective wound healing following the procedure. Our HyalaFuse patent has featured since our very first DP Dermaceuticals product, which is the Hyla Active. The development of this has now seen a triple molecular weight of hyaluronic acid, which now takes it right down to a molecular size of 10 kilodaltons. The second and the third biopsy come from an independent third-party clinical study at Monash University in Melbourne, Australia. The second biopsy shows that when the molecularly manipulated hyaluronic acid is applied onto an intact human forearm, there's no injection, there's no microneedling, there's no exfoliation of the skin beforehand. 20 minutes after application, we see the movement of the molecularly manipulated hyaluronic acid now sitting in basal epidermis. The third biopsy shows the movement of this continues, where we now see the smallest 10 kilodaltons of hyaluronic acid in molecular size now making its way down to papillary dermis. So with this, we've got an understanding that if we can manipulate, if we can play around with the HyalaFuse complex, that it can enable topical penetration. This now means when we blend this in with our classic DP Dermaceuticals, but into our standard MG collection here, this allows for a safe and effortless delivery system. Again, it's non-cross-linked, so there's no risk of granulomas here. It's not a filler. Likewise, how I also understand our HyalaFuse technology is a lot like an envelope. You place your other active ingredients into the envelope here, close the envelope, and then you can use a speedy delivery system to take that into the skin, which now creates an unsurpassed concentration of all of the actives. To take this further, what we also have is a specialized hydroxyapatite microsphere, and this is a calcium phosphate. So just with this tiny cotton here, I want to show that this sponge here is able to hold solution and able to hold product. So what we've discovered with the hydroxyapatite here, which is also known as hydroxyl apatite or a calcium phosphate here, is that it too serves as a delivery mechanism. However, because of the sponge technology, it allows for a time release and a sustained system. It's non-liposomal, so it's very up to date. It's non-polymer, so we now have an effective system that is compatible with the skin. In fact, because it has an activation of lamellogranules within the skin, which are responsible for the production of ceramides, but also free fatty acids, we understand and see that the calfosome technology works with the skin's acid mantle to now promote better efficacy and to now promote better tolerance and better infusion into the skin. So this is where we get our micro sponge technology, which works with the skin's own natural environment. The skin's pH will sit between about 4.5 and between about 6.5. So working with the skin's natural pH and acid mantle, this now enhances the capability of the calfosomes themselves. What we also find, particularly from studies from Van Logem, is that we can also create an activation of fibroblasts with the calfosome technology. At this point, you were probably Googling calfosome and not much is coming up. Calfosome is a trade name. Calfosome is the patent for this technology. So the formal chemical name is hydroxyapatite or calcium phosphate for this. What we have is a safe delivery, so again, no risk of granulomas, and as such, the calfosome just breaks down into calcium and phosphate ions, which means that there is no risk to the patient. But it also means that we have an unsurpassed concentration and delivery mechanism. So at this moment, I'm just going to stop sharing my screen because I want to show an example here. This is my calfosome. This is a cotton sponge. This is my actives, which are contained in my MG collection. So if I now fill this sponge up with my actives, you'll notice that my sponge is turning blue. So you'll notice that the sponge is highly effective in being able to serve as a facilitator to hold the actives which are contained within the MG collection. Now from the calfosome technology, this micro sponge, we're going to use our HylaFuse technology, which is our express post envelope. So we now place the sponge into the envelope, we seal that, and now the HylaFuse serves as an effective delivery system. So what we now see is the ultimate of infusion, the ultimate of safety, the ultimate of risk-free procedures, no granulomas, but the ultimate of skin tolerance for this. Back onto my screen sharing for you. So with this, we now see an advantage of combining in both calfosome, but also HylaFuse technology to now create ingenuity for the new MG collection. The MG 35 Plus also contains telomere technology. Telomere technology is known as GGP, if you wish to research that longer, otherwise known as geranyl lysopropanol. With this, I want you to imagine that a telomere is like a piece of string. As such, it's referred to as a repetitive nucleotide, which sits at the end of the chromosomes. And with this piece of string, it undergoes a repetitive nature for this, and around about 2,500 times. The problem is that the pieces of string, every time it recreates and undergoes this repetitive process, become shorter, shorter, and shorter for this. So we see that they decline from around about 11 kilobases for childhood to around about 4 kilobases for adulthood. So we understand that if this slows down replication, this now can accelerate to aging of the skin. And so by using GGP technology in the MG-HA35+, which also contains an unprecedented 35 milligrams of hyaluronic acid, we now open up greater opportunity for biorevitalization, regeneration, and repair physically within the skin. Let's talk the product selection that we have. Number one is the MGBL, which is this product here. The MGBL now continues on from our classic bright light. So instead of using bright light and Hyalactive blended together, you can now use the BL as a standalone procedure. It too features 10 milligrams of non-cross-linked hyalofused hyaluronic acid technology. It likewise uses a specialized blend of tyrosinase inhibitors. So by placing these physically into the skin, basal spinosum for epidermal pigmentation, into the epidermal junction, superficial papillary dermis for dermal pigmentation or melasma, the tyrosinase inhibitors can now sedate the melanogenesis response. So we see a combination of kojic acid dipalmitate, a specialized oil and water-soluble sodium ascorbate phosphate or vitamin C. There's no acidity issues with this, no irritation for the skin, perfect tolerance. Licorice, bearberry, and copper peptides. So all of this combined together now creates an effective mesotherapy, which can be applied onto the skin topically, can also be applied via a Luer lock syringe, and now infused into the skin as an update for our traditional bright light and Hyalactive. Moving on, we now see that the perfect treatment, particularly for acne, is the MG Clearer. The CLR is pronounced Clearer, and this will take over your classic DP dermaceuticals of using the Clearer lotion plus the Hyalactive combined together. So you can use the Clearer as a standalone mesotherapy. There's 10 milligrams of non-cross-linked hyalofused hyaluronic acid, a specialized oligopeptide, which is antimicrobial and antibacterial for P. acnes bacteria, niacinamide to promote better quality of skin lipids and also the skin's barrier function, but also reduces inflammation. Copper peptides for increased wound healing, but to reduce any post-inflammatory hyperpigmentation, and a combination also of licorice and kojic acid dipalmitate, again for any risk of post-inflammatory hyperpigmentation. Pyruvic acid serves as a minor corneolytic, but at a pH of 4, again, this is not irritating the skin. This is not creating any flaking or any frosting for the skin. So now for any acneic skins, the MG Clearer solution, which can be used by itself. It also features Manuka honey and also Boswellia serrata extract, which now also promote faster wound healing. For a multi-purpose product, particularly for the treatment of wrinkles, but also for scar revision and striae, is the MGRAS. And the MGRAS has been designed as a specific solution that is going to work for post-acne scars, that will work for stabilized hypertrophic scars, that works for deep and superficial wrinkles, but also works for striae. Again, with the RAS, which stands for Reversing Aging and Scars, we have 10 milligrams of non-cross-linked hyaluronic acid, hyalofused technique, combined in with 0.1% of retinaldehyde. So that is twice the amount of retinaldehyde contained in the traditional retinal active, which now deems it as 800 times more potent than 1% cosmetic grade retinol. So where you were traditionally using your retinal active plus your Hyalactive, we can now replace with the MG solution RAS. Copper peptides serve to balance as tyrosinase inhibitor and to accelerate wound healing. Likewise, a pentapeptide 18, which is Azuralox, now also helps with collagen moderation within the skin, but to also promote more effective wound healing, particularly for treatment of scars. We see Jaruticide, Centella asiatica, but also shiitake mushroom. The pH of this product is 5.5 and can be used as a standalone product for treatment of wrinkles, scars, stretch marks, but also post-acne scars. Now we move into the territory of upgrading our MG collection, and we now move into the territory of unsurpassed levels of hyaluronic acid. The first product for consideration is the MG HA35. As the name implies, it's 35 milligrams per milliliter of non-cross-linked, triple molecular weighted hyaluronic acid. So we are seeing that this is a higher amount than what we commonly see in fillers. But again, it is not a filler and it is not cross-linked. There is also calfosome technology. So we remember that we have our calfosome, our micro sponge. We fill it up with our ingredient actives and then apply that into our Hyalofuse envelope, which then can be delivered express post into the skin. Vitamin C in the form of sodium ascorbyl phosphate plus zinc plus panthenol. So in fact, the MGHA35 can be blended in with any of your other MG products to now create a premium procedure. So as such, it can be blended in with the BL for treatment of pigmentation and also dual treatment of anti-aging. It can be blended in with the Sclera. So for treatment of acne, this now allows also for treatment that will affect any post-acne scars, and it can also be blended in with the RAS. So we have variety of being able to customize, enhance our treatments by simply blending, mixing, and matching. The MGHA35 also contains an unprecedented 35 milligrams of hyaluronic acid that is triple molecular weighted and non-cross-linked. We also have our calfosome technology, so our sponge of calcium phosphate, which now serves as a delivery mechanism with our Hyalofuse for the ultimate infusion within the skin. The HA35 contains the telomere or GGP technology. Added in a vitamin C, oil and water soluble sodium ascorbyl phosphate at 3%. Not only do we moderate collagen production, but also as an effective tyrosinase inhibitor. Retinaldehyde at 0.1%, making it twice the amount that is contained within the retinal active. And a combination also of retinal palmitate or vitamin E ester, vitamin E itself, and zinc. Add in specialized power peptides such as Matrixyl 3000, Jaruticide, Centella asiatica, and ferulic acid. We're now promoting the ultimate of reepithelialization, but also the ultimate in wound healing. And the MG35 Plus, again, can be combined in with any of the other MG collection products, from the BL for treatment of pigmentation and anti-aging simultaneously, the Clera for treatment of acne, but also post-acne scars simultaneously, the RAS for treatment of wrinkles, stretch marks, and scar tissue, but also for revitalization and refresh of the skin. So we have this complete variety and this ultimate synergy of solutions with the MG collection. So now for our three-dimensional treatments. If you see hyperpigmentation, your first MG selection is going to be the BL. So we now have a more up-to-date technology, no longer the bright light and the Hyla Active, we use the BL. If you want to update the BL, then all you can simply do is mix and blend it in with either the HA35 or the HA35 Plus. So as we begin to blend, as we begin to customize our cocktails, it also attracts a higher premium price point for the patient, but also allows for you to accelerate your overall treatment program. So we have options. For hyperpigmentation, safe for all skins, all ethnicities, the Uber Pro for application following your Dermapen and infusion with the MG collection. If you see wrinkles, rather than your traditional hyperactive and retinal active, why not use the RAS? And the RAS now works and serves with a potent blend of copper peptides and retinaldehyde, and this can be used as an individual sole treatment applied onto the skin, but you can also mix the RAS with the HA35 or the HA35 plus for the ultimate procedure. Following application of Dermapen and following your RAS, whether that is blended or whether that is a standalone procedure, you can use the Uber Pro all over the skin for a generalized refresh. However, for treatment of deeper wrinkles and for a patient who is appropriately prepped and a patient who is of the right demographic, you can do a line peel with the Uber MD for localized focus on deeper wrinkles, but also for post-acne scars. This is also the same combination that you can use for atrophic scars, particularly post-acne rolling, boxcar, ice pick, but can also be used for anatodermic, but also for post-traumatic atrophic scars. So our blend is using the RAS. You can enhance this, particularly with the unsurpassed levels of hyaluronic acid in the MG35 or the HA35 plus combined together. And again, for treatment where appropriate, you can treat for a faster, more dramatic response using the Uber MD with the Uber stick, but that is only to be spotted or line peeled, never to be applied all over a large surface area. This is also the same combination that you can use for stretch marks. So the MGRAS, you can enhance that. We see great evidence of high concentrations of hyaluronic acid to now promote better strength of the extracellular matrix, particularly for stretch marks where the integrity has been broken down. We now also see the combination therapy where appropriate of Uber MD, but also only to be applied on the right skin, the right response, right reaction using the Uber stick. Where we also see versatility for post-inflammatory hyperpigmented acne, we can use the MGBL, which works flawlessly, but we also have tyrosinase inhibitors, which exist in the clearer. So again, there's versatility. For treatment of acne, but also treatment of acne with hyperpigmentation, we would use the Uber Pro as part of your combination therapies. So we see a very, very similar process, which now takes us and updates us from our traditional Hyperactive Plus Bright Light or Hyperactive Plus the clearer lotion to now using either MGBL or the MG Clearer, but both of these indications can safely, predictably, and reliably use the Uber Pro. Finally, for rosacea or telangiectasia, you have the option of using the MGRAS. Alternatively, you could use the HA35 by itself, or you could blend the two together. For your rosacea patients, this is one indication where they will not be suitable for an Uber Pro nor an Uber MD. So we see the versatility here to create a three-dimensional effect, working within the skin from the bottom up using your Dermapen, working within the skin with the placement of your biomimetic actives with your MG collection, and now working from the top down by working and utilizing your Uber Pro or Uber MD as required. I wanted to share this new case study, which just came in from the Czech Republic late last week. For this patient, it's a combination of 6 procedures here, but in order to achieve this before and after, this is a combination of Dermapen, a combination of our traditional Meso Glides, the Hyperactive and the Bright Light, the Hyperactive and the Clearer, but we now also have a combination as the new MG collection was launched, and the blend was the MGRAS, reversing aging and scars. But we also have a combination therapy here initially of the Uber Pro to treat the acne, and then moving into Uber MD with an Uber stick to now treat the post-acne ice pick scars. So here we see the versatility of using the best of DP Dermaceuticals, using the best of MG Collection, the best of home care of DP Dermaceuticals, the best of Uber, and the best of Dermapen to now create the ultimate four-dimensional approach for skin. That concludes the formal part of my presentation, but now hopefully this inspires you to understand that our programs are versatile. Our programs are flexible, and by understanding our product and by understanding our skin, we can now customize, we can now tailor to create the ultimate four-dimensional approach, including home care as part of the equation, to now create the ultimate treatment plan. Now let's have a look at some of the questions which have come through. The first question asks, can I use the MG collection throughout the entire year? Summer. Yes, you can. So we have safety that your Dermapen and your MG collection are a fractional procedure. They're non-thermolytic, they're non-ablative. However, you can treat easily throughout any month, but I recommend that your patients are always using and wearing Cover Recover as a basis of their daily home skincare regimen and to protect their skin and to reapply that as a broad spectrum SPF 30. The next question asks, why no Uber Pro for a rosacea skin? There is a slight corneolytic agent, which is pyruvic acid contained within the Uber Pro. And the last thing that we want to do with a rosacea skin is start encouraging a faster cellular turnover for this. The Uber Pro also has a lower pH of 2.08, and this may be too active for a rosacea skin. For the Uber MD, it's a pH of 0.8. So we understand that not all skins are necessarily going to be appropriate for peeling. And in this case, if the skin is volatile, if the skin is affected by anything such as dermatitis or eczema currently, if the skin is in a very bad condition in regards to barrier function, we want to build that up first, and then they may be appropriate. But rosacea is not going to be a combination therapy with any of the Uber products, but I do recommend particularly the RAS from the MG collection and a blending in with the MG HA35+. What I also want to reinstate is, particularly with the Uber MD, is it is not to be applied over large surface areas. If the patient is deemed high risk for post-inflammatory hyperpigmentation, they're not suitable for this. So the Uber MD is only to be applied with an Uber stick, never over a large area. This keeps it fractional, but even where it's been applied, whether that is for post-acne scars, whether that is for deeper wrinkles, there will be a mild scab. So just make sure that the patient is aware. So throughout your consultation, you will explain that there will be a very, very small scab and the patient not to pick at it, and the patient also to follow their appropriate post-op with DP Dermaceuticals, which is vitamin-rich repair, and also the Cover Recover. The scar cream can also be advantageous, particularly following an Uber MD application, just to assist in reepithelialization. It also contains tyrosinase inhibitors. The next question asks is, are the MG products safe for pregnancy? So always get the patient to double check with their doctor before proceeding. So with this, it will be patient to patient for their opinion. So always get their doctor to give you the go ahead for that. The next question is, for the hyperactive mask, does this neutralize the peels? The peels contain self-neutralizing agents themselves. So the Uber Pro is left on the skin between 30 seconds and 3 minutes. No longer. You also don't need to reapply it. However, if you want to speed up neutralization, use the hyperactive mask and it will instantly neutralize that peel out. So for the first few treatments, if I'm not sure about a skin and its reaction, I will neutralize it after about 30 seconds, 45 seconds. With the Uber MD, once it's frosted, it has self-neutralized. So nothing will make that worse. So again, no reapplying for this. But what the hyperactive mask does is now serves as the final mesotherapy, as the puncture channels are now in almost full closure, to now inundate the skin also with a triple molecular weight of hyaluronic acid, highly fused technology, zinc, sodium, manganese, iron, and copper ferments, but also blended in with panthenol. So this serves as the ultimate post-op to now begin the process of faster reepithelialization and also healing. The final question asks, how often for the Uber MD? As a combination therapy treatment, if you're using it for atrophic scars, atrophic wrinkles, and you're drawing blood, you're going to be treating with your Dermapen every 6 to every 8 weeks. So as such, for indications of deep lines and wrinkles, for indications of post-acneic scars, and for indications such as any form of atrophic scars, but also for striae, you would be using Dermapen. Your base solution is the RAS, but you can enhance and build that by combining the RAS with the HA35 or the HA35 plus as your mesotherapy, as your Meso Glide, and then you would apply the Uber MD utilizing an Uber stick. And this can be performed every 6 to every 8 weeks as part of safe intervals. That concludes all of our questions, and that concludes the formal part from me. I'm going to hand you back over to Michelle, but a huge thank you to the very phenomenal team at Pro Beauty. A huge thank you for all of you for taking some time out to come and visit with me this morning, afternoon for you, and a huge thank you for making the dedication for making education an ongoing journey and an exciting and inspiring journey with the brand new MG collection, but now updates and innovations for a 4-dimensional treatment, DP Dermaceuticals, Dermapen, MG collection, and the Uber Pro and MD. Thank you so much. Over to you, Michelle.
Thank you. Thank you so much, Andrew. A very interesting and exciting presentation. I can't wait to get my hands on the MG, and just some really nice options for us there to extend our treatments and the whole 3D treatment. Amazing. So thank you as always. And we'll see you again soon.
Perfect. Take care, New Zealand. Please keep safe. And I will see you online some point very, very soon. Thank you.
Bye.